Hello all. This is Luke from Let's Speak. I'm here with an OET speaking roleplay for nurses. Watch the video completely. Here's the roleplay card. You have 3 minutes for preparation. After that, you can do the roleplay with us. At the end of the video, you can get our version of the full conversation. So start preparing.
Your preparation time is over. Now let's speak. We'll play the interlocutor's part of the conversation. And you can add the nurse's, or your part accordingly. Don't worry if you can't catch up or manage time. You'll be able to do that with practice. And at the end of this video, we'll provide you a full version of this conversation. So, let's speak.
Good morning. I was bitten by a dog on my left leg, and I'm quite nervous. Could you do something to manage this? Sure. No, nurse, I'm fine. Thank you. My name is Philip Dunphy, and I'm 30 years old. Sure. Yeah, sure, no problem. Of course. I was bitten by my girlfriend's dog. And this happened when I went to meet her. It's about an hour ago. Actually, nurse, it broke the skin, and it was bleeding. So I guess it's a little deep. I didn't clean the wound, as it was bleeding. Instead, I covered it with a sterile cotton pad and applied pressure, and I didn't dress it or use any cream. No, I haven't. Sure, nurse. Yes, it's clear. I don't remember that exactly. It was very long back. Yes. I'm willing for that. Yes, nurse, I have a question. How many stitches do I need? Yes. No. Okay. No problem. Thank you, nurse.
I hope you performed well. So now listen to the full conversation.
As per the question, the 30-year-old patient has arrived at the emergency room with a dog bite. And it's clearly an unknown case. And since the gender is not specified in the background information, you need to assume the interlocutor's gender as the gender of the patient. So here, since I'm male, we can assume the patient as a 30-year-old man. So listen to the conversation.
Good morning.
Good morning.
My name is Luke, a registered nurse working here. May I know what brings you here?
I was bitten by a dog on my left leg, and I'm quite nervous. Could you do something to manage this?
Oh, it's quite concerning to hear that you were bitten by a dog. But please relax, and no need to be nervous.
Okay.
As you are in the emergency room, we can definitely help to manage the situation. But before continuing, please sit here, on this examination table.
Sure.
Are you comfortable, or do you need any support for your leg?
No, nurse, I'm fine. Thank you.
Okay. So now, I need to document your details. So could you tell me your name and age?
My name is Philip Dunphy, and I'm 30 years old.
Alright. Thank you, Philip. Firstly, may I have a quick look at your injury?
Sure.
Okay, thank you. I have done preliminary assessment, and thank you for cooperating with me, Philip.
No problem.
Now, would you mind if I asked you some questions, to get more details about the situation?
Sure.
Thank you, Philip. So could you tell me what really happened?
Of course. I was bitten by my girlfriend's dog. And this happened when I went to meet her.
I'm really sorry to hear that. Anyway, when did the dog bite you?
It's about an hour ago.
May I know the severity of the wound?
Actually, nurse, it broke the skin, and it was bleeding. So I guess it's a little deep.
Did you try to treat yourself, like cleaning, dressing, or applying any antiseptic cream?
I didn't clean the wound, as it was bleeding. Instead, I covered it with a sterile cotton pad and applied pressure, and I didn't dress it or use any cream.
Have you taken any painkillers?
No, I haven't.
Thank you very much for the details. And by the way, we will be commencing the treatment soon. But before that, may I explain you the possible treatment?
Sure, nurse.
Thank you for the permission. First of all, your wound will be cleaned, so that assessing the wound would be easy. After that, it would be examined by the doctor. Based on the doctor's assessment, you would be sent for blood test, to check for the chances of infection. And even there's a possibility that you need to take an X-ray, to make sure that there is no bone or tendon damage. Finally, after such investigations, the doctor will prescribe you some medicines, such as antibiotics and painkillers. Am I clear to you?
Yes, it's clear.
Moreover, as it's a case of dog bite, it's highly recommended to take a tetanus booster. Because, there may be presence of foreign particles in the wound, which can complicate the situation. So may I know, when you had your last tetanus booster injection?
I don't remember that exactly. It was very long back.
That's fine, Philip, you can have the booster dose now. Are you willing for that?
Yes, I'm willing for that.
That's a very good decision. So do you have any questions for me?
Yes, nurse, I have a question. How many stitches do I need?
Your question is really sensible. However, according to the current recommendations of the World Health Organization, no stitches are initially provided for the wounds from animal bites. Because the wound will be easier to clean, and there will be very less risk of getting infections. And later, after proper assessment, doctor will be deciding the exact number of stitches, depending upon the severity of the wound. Is that clear to you, Philip?
Yes.
So do you have any further queries?
No.
Okay, so please stay calm and relaxed, Philip.
Okay.
The doctor will be here soon, to confirm the treatment, on examination. And you may need to come for a review, after a few days, according to the doctor's instructions. Are you okay with that?
No problem.
So if you need any other assistance, kindly ask me, I'll be here around.
Thank you, nurse.
Thank you for listening to me patiently.
I hope you understood the roleplay. Subscribe to Let's Speak by Insight OET for more OET speaking content. Thank you for watching.